Here's a harsh truth. A diagnosis can change everything in an instant. It can alter your perspective, your plans, and your entire future. Every 5 minutes, someone, somewhere in the world, is diagnosed with multiple sclerosis. That's more than 280 people every single day. No prize, no fanfare, just a lifetime of neurological chaos. A journey filled with uncertainty, challenges, and the constant need for support. Over 2.8 million people live with MS, a staggering number that represents individual stories, families, and communities impacted by this condition. And where you live can make all the difference in your fight. Access to care, innovative treatments, and specialized support varies dramatically across the globe. Your passport could be your most powerful medicine, a key to unlocking potentially life-changing treatments and opportunities. Determining your access to treatments and specialists, the quality of care you receive, and ultimately your chances of managing this complex disease effectively. And hope. The hope for a better quality of life, for slowing the progression of the disease, and for a future where MS doesn't define you. This isn't just about policy, it's about the fundamental right to healthcare and the responsibility of nations to provide equitable access to treatment. It's about real families facing a global healthcare lottery, where their postcode can dictate their destiny in the face of a debilitating illness. We're taking you on a world tour of MS care, a journey to understand the landscape of treatment and support available across different countries. The countries leading the charge, investing in research, and providing cutting-edge therapies to their citizens. Those struggling, grappling with limited resources, outdated treatments, and systemic challenges in their healthcare systems. And those falling behind where access to even basic MS care remains a distant dream for many. Because in the battle against MS, geography can be destiny, shaping the course of your illness and the quality of your life. Let's pull back the curtain and see which nations are winning and which are losing in this global fight against MS. And why it matters for everyone, because ultimately, a world where MS care is equitable is a world where everyone has a chance to thrive. So, what is MS? It's your immune system attacking your own nerves, stripping away the protective myelin sheath. Imagine your brain's messages getting scrambled. One day you can't see clearly, the next your legs feel like lead. Symptoms are unpredictable: numbness, fatigue, memory problems, and more. No two cases are the same, making life and treatment unpredictable. That's why research is crucial, to understand, treat, and one day prevent MS. This isn't just a medical issue, it's a human one, affecting every part of life. Before we hand out more gold stars and global kudos, let's make a quick pit stop. If you're finding this video helpful, or just love learning wild facts about the human brain, go ahead and smash that like button. Seriously, it helps way more than you think. And if you want more deep dives with a dash of sass into health mysteries from around the world, hit subscribe and ring that bell. Join our crew of curious minds and never miss a beat. Alright, back to the action. Alright, let's get down to brass tacks and hand out some well-deserved trophies. We're not talking participation awards here, but recognizing the real MVPs in the fight against MS. When we look at the global landscape, certain regions stand out. Western Europe and Scandinavia, think Switzerland, a country synonymous with quality and precision. Denmark, known for its progressive healthcare policies. Germany, a powerhouse of medical innovation and infrastructure, are consistently recognized as MS care all-stars. These countries aren't just doing things right, they're setting the gold standard. They offer fast access to neurologists, ensuring that patients receive timely and expert care, advanced imaging, allowing for early and accurate diagnosis, and a full range of therapies, from cutting-edge treatments to essential rehabilitation services. Germany leads the pack with specialist access, making sure patients can see the right expert, right when they need to. And integrated MS centers. These centers bring together all the necessary resources under one roof, streamlining care and improving outcomes. Denmark's National Registry, a comprehensive database of patient information, fuels research breakthroughs, providing invaluable data for scientists working to better understand and treat MS. Canada and Australia also shine, demonstrating a commitment to excellence in MS care, with strong research initiatives and robust patient support networks. They understand that living with MS requires more than just medical treatment. So what exactly sets these countries apart from the rest? What are they doing that makes such a significant difference in the lives of people with MS? The answer in large part lies in integrated care teams. Neurologists, the specialists who lead the charge in MS care. Therapists, who help patients maintain mobility and independence. Nurses, the compassionate caregivers who provide essential support and monitoring, working together seamlessly for the well-being of the whole patient. It's a holistic approach that addresses not just the disease but the individual, and it's not just about drugs. While medication plays a crucial role, it's only one piece of the puzzle. It's about supporting lives, empowering individuals to live as fully and actively as possible, despite the challenges of MS. These nations prove, through their commitment and results, that with strategic investment and a clear vision for patient-centered care, people with MS can truly live fulfilling and meaningful lives, not just survive, but thrive. They set the benchmark, raising the bar for what's possible in MS care for the rest of the world, showing us all what can be achieved when we prioritize the needs of people living with this challenging condition. But even in top countries, big problems remain, starting with cost. Cutting-edge treatments can cost over $100,000 a year, sparking debates and leaving many behind. Access still depends on where you live. Even in Canada, city dwellers fare better than those in remote areas. Research is slow and a cure remains elusive. Most treatments only slow progression, not repair damage. Overworked doctors and fragmented care mean mental health and daily struggles often get overlooked. The system treats the disease, not always the person. So, while progress is real, massive gaps persist worldwide. Here's the hope. Global teamwork is changing the game. International alliances like the MS International Federation unite researchers, clinicians, and patients. Collaborations like the International Progressive MS Alliance accelerate breakthroughs by pooling knowledge and resources. Patients are now powerful advocates pushing for better funding, affordable drugs, and public awareness. Online communities connect people across borders, amplifying their voices. More funding and partnerships mean more innovation and faster progress. When the world teams up, we become an unstoppable force against MS. So, where are we in this journey against MS? We've arrived at a critical juncture, a moment that demands reflection and renewed commitment. We've made huge strides, significant progress in understanding the complexities of this disease. Scientific breakthroughs have illuminated new pathways, and medical research has yielded promising results. But now's not the time to slow down. The momentum we've built must be maintained, and indeed, accelerated. We cannot afford to become complacent or lose sight of the urgency that drives our mission. We need more research, deeper investigations into the underlying mechanisms of MS. We need to explore innovative therapies and refine existing treatments. More funding, sustained financial support to fuel these research endeavors. Investment in MS research is an investment in hope, an investment in a future free from the burden of this disease. And global collaboration, a united front against a global challenge. Sharing knowledge, resources, and expertise across borders is essential to accelerate progress, to find a cure and better treatments, to alleviate suffering and improve the quality of life for those living with MS. Our ultimate goal is to eradicate this disease altogether. Access must be fair, equitable, and just for all individuals affected by MS regardless of their background or circumstances. No one's care should depend on their passport or income. Healthcare is a fundamental human right, not a privilege reserved for the fortunate few. It's up to all of us, every single one of us, to contribute to this cause, to demand better healthcare, transparent pricing, and patient-first policies. We must advocate for policies that prioritize the needs of patients and ensure access to affordable, high-quality care. The MS community is more connected and empowered than ever, a powerful force for change. But they need our support. They need our voices to amplify their message, our resources to bolster their efforts, and our unwavering commitment to stand alongside them in this fight. Get informed, educate yourself about MS, its impact, and the ongoing efforts to combat it. Share this story, spread awareness, and help us reach a wider audience. Support MS organizations, contribute to their vital work, and help them continue their mission. And use your voice. Speak out, advocate for change, and demand action from our leaders. Together, we can change the future for everyone affected by MS. We can create a world where MS is no longer a threat, where individuals can live full and healthy lives. Let's decide we're all in this together. Let's unite our efforts, amplify our voices, and work tirelessly towards a future free from MS.